In any proctology OPD, hemorrhoids and anal fissure constitutes bulk of the patients. If we see the distribution, the proportion of hemorrhoids patients is around 65% and anal fissure is around 15 to 20%. It is seen that in both the disease there is one common or overlapping symptoms of bleeding during or after motion, and almost all the patients have this confusion or question whether they are suffering from hemorrhoids or anal fissure. Well, before proceeding forward in this video, one thing I would like to mention very specifically is for diagnosis and confirmation of any anorectal disease, you need to visit a proctologist or a surgeon and get a proctoscopic examination done for confirmation. Starting with hemorrhoids, the number one symptom of any hemorrhoids patient is bleeding during or after motion. This blood is usually seen in the toilet seat. The color of the blood is bright red in color, and it is usually a fresh bleed, and this bleeding is never associated with pain, unlike anal fissure. The second most common symptoms of hemorrhoids is feeling or sensation of a swelling or a mass coming down during motion, which reduces spontaneously or manually. Other symptoms being discomfort on sitting or itching. Although the bleeding is usually painless in any hemorrhoids patient, however, there are certain exceptions, such as if you have a complication such as strangulation or thrombosis or incarceration. In those situations, you might experience severe anal pain. Now, coming to anal fissure, almost all the patients of anal fissure present with this complaint of pain during or after motion. The nature of pain can be quite severe in some situations, and it can last from few minutes to few hours. The pain is usually episodic, or you can say cyclical in nature. What I am trying to say is that for a few months you might experience pain on a daily basis, then with or without medications you might experience a symptom or pain-free period. During that period you might feel that your anal fissure has completely cured, but all of a sudden on any fine day again your symptoms will recur. This is a typical presentation of any anal fissure disease. Bleeding is also seen, but it is not always. The quantity of blood is not so much as seen in a hemorrhoids patient. Usually it is around few drops of blood seen in the toilet seat, and also on thorough examination you might feel or see a small cut at the anal verge or the anal opening.